more and more clue development on what's going on. Okay? So remember I talked about the clock analogy, helps us with the chambers. A lot of times we don't really use that because we're looking at the cardiac waste. So if I tell you this dog has a loss of cranial cardiac waste, there's a couple of things that'll do that. Aortic arch is the main one, then main pulmonary artery, then the right atrium, in that order. Okay? So those are going to be the most common. When we talk about loss of caudal cardiac waste, the main one that we're worried about when we see that is the left atrium. Okay? And I got an animation on this, I'm gonna see how it works. So, primary cause of loss of caudal cardiac waste is going to be the left atrium. And then you'll talk about the pulmonary veins. So let's see if it draws it for me. Alright, so this is showing you the actual loss of cranial. And you see how that bulges out? That's how it should fairly be normal in appearance, like that. Then, okay, so that soft tissue opacity that you guys are seeing on the loss of caudal cardiac waste, this is all the left atrium bulging out there. Okay, everybody appreciate that soft tissue opacity? And so it should look something like that. Mind you, I was drawing with a mouse and a clicker. Okay. So it might not be to the exactness, but at least trying to get you some outline. All right. So other subjective changes, and since this thing takes forever. So remember I talked about the carina. That's another quick assessment. Okay. When we talk about the carina, we split in our heads. We split this thorax into 3 equal parts. The carina should live somewhere near this bar on the lower upper third. That sounds backwards, but lower upper third of the thorax. That's how we should see that nice rounded lucency as we get ready to do the bifurcation, right? But on this one, you see it's displaced dorsally. Primary cause of that? Left atrial disease. Okay? Dorsal displacement of the carina, left atrium. You're usually going to see it with the loss of caudal cardiac waste. Left atrium. Let me see, 1, 2, say it one more time. Loss of caudal cardiac waste and elevation of the carina. Your main differential is left atrial disease. So that's the carina. Okay? Then, the one that, this one's a little harder, but when you have a case this severe, you can definitely depend on it. But a lot of times we talk about increased sternal contact. All right, that's going to indicate some type of ventricular enlargement, most commonly left ventricular. Okay, so this one isn't as reliable, especially by itself, but if you see it in a situation like this, you definitely can use that. And you're going to put that into your radiographic findings. So if I were to describe this, it would say there's dorsal elevation of the carina, loss of cranial and cardiac waste with increased sternal contact. Okay? That's indicative of left-sided heart disease. So I have left atrial and left ventricular disease going on here. I just gave you a lot, but that's okay. Because by the end of this topic session, you guys will be good. All right. So we've gone through most of these parameters on how we're going to describe things. Okay, so the breakdown. This is how you're going to talk to yourself, in your head or out loud, whichever you're most comfortable with. You're going to first ask yourself, is the heart abnormal? No, then you stop. If it is big or small? You're going to first use the intercostal space. If the intercostal space is within normal, but you still feel like there's some things that are kind of funky about it, then go ahead and do a vertebral heart score. If it's still not big and it's small, okay, then you start talking about things that cause myocardia or hypovascular lung failure. So this is me trying to, all right, so is it big or small? If it's big, we're going to start start looking at vessel size, we're gonna look at the carina, we're gonna look at the waistline, we're gonna look at the clock analogy, and you're gonna further define it. So that's gonna be your main way of coming at these situations. All right. So I think we can take a little break. Let me see. Yes, let's take a little break. And then we're gonna come back and we're gonna practice. All right, that means everybody's gonna get up out their seat and everybody's gonna be at a TV. Let's take a 10-minute break. Get your blood moving, get your eyes open. Yes. And I said we're not
I agree. Girl, girl. No, it's not just you. And you blind. I can see it. Literally, she was like, the only reason I see some of these things is because she pulled up the older PowerPoints. Like
The one from Dr. Perry.
Yeah, but it didn't look this exact.
No, that one was different. I just showed her what's normal. Okay, so wait, we're getting up and we're moving. What's weights? I'm so tired. My back is killing me.